Good morning, everyone. We're going to get started. It's a pleasure to welcome Dr. Ethan Freed. Dr. Freed is a graduate of the City College of New York, Sophie Davis School of Biomedical Education, which is a 7-year BS to MD program, and SUNY Stony Brook School of Medicine. He did his residency in medicine at SUNY Downstate, Kings County Hospital in Brooklyn, and a fellowship in pulmonary critical care medicine at the Cornell University program. He also received a master's degree in clinical epidemiology from the Harvard School of Public Health. He's currently Associate Chair for Education and Internal Medicine Residency Program Director at Lenox Hill Hospital, which is part of what officially on January 1st will become Northwell Health, formerly North Shore Long Island Jewish System. He's also Associate Professor of Medicine at Hofstra School of Medicine. And as you all know, Hofstra is our wonderful sister school who's a year ahead of us in their development up in Long Island. He's also the Associate Designated Institutional Official for Lenox Hill. He's active at the state and national level. He's a member of the New York Council on Graduate Medical Education, advising the state legislature and the governor on matters pertaining to medical education. He served as the national president of the Association of Program Directors in Internal Medicine in 2010 to 11, and is currently chair of the Alliance for Academic Internal Medicine Committee for Diversity and Inclusion. His research is in patient safety and medical errors, and he's the PI for the National American College of Physicians Near Miss Registry. In 2012, he was honored for all of his contributions to academic medicine by induction as a Master of the American College of Physicians. So please join me in welcoming Dr. Freed.
That's our logo here. This shield used to be blue, and then Blue Shield apparently didn't like that. They were going to sue us, so we changed it to white, and now it's a white shield. So it's very pretty, I think. And North Shore LIJ over here, which will soon become Northwell. And more often I say it, the easier it becomes to say. So that's going to be our official system name, and Lenox Hill Hospital is where I am. PM21 is a curriculum that we run in our residency training program. We call it the practice of medicine in the 21st century. And it includes things like clinical reasoning, which we talked about last night, and evidence-based medicine, high-value care, quality, and safety. So this is just a brand that we put on a lot of our teaching programs to sort of keep the brand going. So we're talking about mentoring today, mentoring in academic medicine. And much of what I say is going to come out of this book, which is Holly Humphrey's book on mentoring in academic medicine. This is part of the American College of Physicians Teaching in Medicine series. So it started out with 5 books, teaching in hospital settings, teaching in ambulatory settings. Mentoring is one of the volumes. Then a 6th book just came out in Teaching Clinical Reasoning, which was edited by Mark Graber. So it's a really wonderful series for anybody who's interested in academic medicine, teaching in medicine. If you're an ACP member, you get a little discount. If not, it's really not all that expensive. So this is a wonderful series of books to go through. So a lot of what I say is going to come out of this, of Holly's discussion of mentoring. So the first step, obviously, when you're trying to mentor people along, bring them along in their need to take time to figure out where they want to be in a year, 5 years, 10 years. And this notion of planning ahead, when we talk about this, we interview candidates and say, oh, where do you see yourself in 5 years or 10 years? And we almost use it as an icebreaker. But it's a legitimate question to ask somebody who's in training. What's their real passion? And where do they see themselves? How do they, what aspects of their training and of their skills do they want to really develop? These books are really just inspirational books. Not a single one of them has to do with medicine. They're just very, I found them very inspirational. I found them very influential in my teaching style. The 7 Habits, Stephen Covey's famous book. It was on the New York Times bestseller list for, I don't know, 7 years. Oh, am I not? I thought I was reaching there. Did you not hear me? As I said, I usually fill a room. Low. Oh, wow. I could take over the world with this mic. It's like backwards now. Okay, totally broke my rhythm. Okay. So Stephen Covey's book was very well received and taught me how to write my personal mission statement many years ago. It's a wonderful read and I think very influential. Roz and Ben Zander, The Art of Possibility. Anybody that's interested in teaching really ought to read this book. Roz Zander is a clinical psychologist. Her husband, Ben Zander, actually is the principal conductor for the Philadelphia Orchestra. Is it the Philadelphia or the Boston? It's the Boston Orchestra. And just a wonderful teacher, and discusses teaching and the love of teaching. I found this very influential to me. Jim Collins, Good to Great, talks about doing what you're really, really good at, the so-called hedgehog concept. The principle here is it's based on the old myth, the fox can do many things, the hedgehog does one thing really well. They roll themselves into a ball with their spikes sticking out, and they're basically impenetrable. Finding out what is the one thing that you do better than anybody else, and then pursuing that is a wonderful, inspirational message. Brene Brown talks about vulnerability. The best way to become great is to become vulnerable, and you then acquire the help of many others. And Dan Pink's Drive is a wonderful discussion about motivation in a modern age. So these are just nice, inspirational books. They've helped me over the years, and they've helped to sort of form the way that I try and get my trainees to achieve great things. So these are the books here. But the next step is to consider what has changed. And I think that we always have to consider, and you're a new medical school and we're a new medical school, we always have to consider millennial learners and what some of their needs are. They're different than many of us and the way we were trained and the way we were sort of brought up in the academic world. This is an adaptation of a slide that Larry Smith likes to talk about, all the various generations going all the way back to the greatest generation, and then the baby boomers, the Gen X's, and today's millennials. And whereas it sort of started out with the satisfaction of a job well done, soon gave way to sort of money, title, recognition. This sadly is my generation. And then after a while, the children of that generation sort of reacted against that and said, you know, we don't want to just always be at the office. We want to have freedom. We want to have time. We want to reconnect with our families. And then out of that grew the millennials back to a sort of a philosophy of doing work, but work that has meaning. And today's learners really need to feel that they're a part of the process. They really need to feel that they're having the experience of working, and even though they have no skills, they still want to be very, very involved. So that's a struggle, as to how do you get them involved even though they really don't have the skills yet. So it's very important to sort of choose the right activities for them so that they can participate, feel that they have meaning, but not hurt anybody. So
we have to look at our work environment. We have to look at the type of environment that our trainees are working in. A lot of things have changed. Duty hours is fully upon us. There's a new financial environment, so there's a lot of financial pressures related to funding for training and funding for GME. There's volumes and volumes of new knowledge available, and yet nothing really has been taken out of the curriculum. There's a lot been put into the curriculum, but very little has been taken out of the curriculum to make room. So it's important to recognize that we're in a very overcrowded knowledge space with regard to training our trainees. Milestones is the latest creation, where we're no longer just worried about sort of having a curriculum or having a set of conferences or having a process to teach our trainees. We have to actually have measurement tools that document how competent they are in each of dozens of milestones, so that we can really say that they are acquiring their skills well. Increased emphasis on teamwork and communications. This is the new environment for healthcare. Healthcare is a team sport now, and teaching teamwork is a big part of what we have to do. And it's very different than previous generations, where being the solo practitioners, being the people that everything depended on, being the Ben Caseys, for those of you who understand that reference, really was very important. Today, it's very important to work as a unit with a lot of other people, and it's something that we have to both teach and make sure that we can measure. Responding to individual patient characteristics, cultural competency, really having patient-centered care which responds to each individual's preferences is a very important part of what we do, and it's important to incorporate that into our work environment as well. And finally, we live now in an information age. Most of our learners prefer not to memorize their facts, but be able to find them in a hurry on some sort of a personal device. And living with that and being able to use that in an effective way is a challenge for many of us who sort of grew up in an environment where rote memorization was really part of what our training was about. So the work environment has changed dramatically. But, of course, there are some things that never change. We still want our trainees to be good physicians, and the attributes of good physicians really haven't really changed. Fidelity, excellence, honesty, altruism, integrity, compassion, justice, courage, the love of being a physician. This is the things that will never change about our field, and it's something to be encouraged in our learners. So, what are the markers along the way? How do we know that our trainees are developing their skills? And there's lots of ways of looking at this problem. This is Miller's pyramid, where we start at the bottom, that our trainees, know what to do, or they know a particular set of medical facts. And then as they grow more experienced or be able to show or know how to produce what they need to produce in their patients, so there's a little higher level of learning. Soon they can show us how when asked, and we go to the bedside with them. They can actually show us how they get things done. And then finally, do they develop good habits that then carry them through their career? So Miller's pyramid is sort of this ascending pyramid of knowing, then knowing how, showing how, and then doing. I often refer to Miller's evil twin, because knowing how is very easy to find out, right? You can just design an exam, you can administer an exam, you can give it to hundreds of people at the same time, and you can find out if they know anything. Knowing how is a bit more complicated. You have to come up with more clinical scenarios. They have to really test people's knowledge of application. Showing how is yet even more difficult, because it involves things like simulation and standardized patients and going to the bedside, and it just takes a lot of time to figure out if our learners can show how they do things. And then doing, or making a habit out of doing these things, is the hardest thing of all. I recently was a visiting professor at the Mayo, and they have a wonderful setup there. There's cameras maybe you've got it here. There's cameras literally in every clinic room. And as the patient is brought into the clinic room, they say to the patient, Mrs. Jones, so, there's a camera here in the room with a microphone. We often look in on our physician's work. Is it okay if we leave the camera on? If the patient says yes, the nurse flips a switch on the wall, the camera goes live, and there is a preceptor who watches the screen all day long. That's all they do, is watch everybody's interactions with their patients. But that's an enormous expense in materials and equipment, and then, of course, the personnel to actually do this watching. So this one is the hardest thing to measure. It's the top of the pyramid, but it's the hardest thing to measure. Anyway, Miller's Pyramid is one conceptual way of thinking about the development of our trainees. RHYME is another one. This is Lou Pangaro's theory about first you become a good reporter, then later you become a good interpreter, later on you become a good manager, and then finally you become an educator. The RHYME methodology of sort of thinking about competence. And there's lots of different, here's the Dreyfus stages from novice to expert. This is what all of our milestones are based on. So there's lots of ways of sort of thinking about markers along the road. Holly Humphrey gives us one, yet one more. So she talks about the stage one, the early entry learner. And the early entry learners, they have these reflex responses which derived from previous non-professional life, right? So our learners sort of come into the game, and that what they're working with is the skills they acquired in college, and even going before college, and it's sort of just the way they were brought up, so to speak. The rules of the profession are not clearly understood. It's really up to us to make sure that they understand what the rules are about, and they have surprise and angst at the reaction to their usual behaviors, right? So these are the millennial learners who don't understand why it's not okay to bring their cup of coffee into a patient's room when they go and examine them or when they go to interview them. Or it's not okay to be looking at their information device there at the bedside. That's going to throw people off. It's going to make people think, well, what is he doing? Why is he reading while he's taking care of me? You need to do that in a place that's really not at the bedside. So they're surprised and anxious at the reaction to their usual behaviors. Stage two is all about reward and punishment. It's all about me. They're trying to figure out the rules. They sort of get maybe counseled or reprimanded for doing something that maybe wasn't quite expected, and then they learn to do it. They learn to do it differently the next time. But they're still very concerned about what's on the test, externally motivated. They just don't want to get in trouble. That's really the key to the stage two learner. In stage three, they become team members. So they're now beginning to be professionalized into our profession. They can hold multiple points of view. The relationships are critical, and the profession is a relationship. So they're really starting to maybe identify with physicians rather than identifying themselves as physicians. Motivation is joining the team. They now want to belong. They want to be depended on. This brings back goes back to what we said in the beginning, that they want to be involved even though they lack the skills. So they want to join the team. And their satisfaction is derived from the success of the team and their relationships. If they're doing well and they're not being yelled at and they feel like they belong, then they're probably being successful. In stage four, they're now beginning to internalize the physician self. Their professional values are now integrated into their self-identity, and their professional behaviors are becoming habitual. They're becoming habits. They can break away from the rules when appropriate, and they know how to lead a team. Stage four learners can be flexible and self-critical, and motivation is now, I know what the right thing is, rather than, I don't want to get into trouble. Their rewards are now becoming internalized rather than externally, or derived from the external sources. And then finally, you have stage five, which is us, mentors, where it's all about others. It's no longer all about me. We're interested in big picture perspective. We teach the rule, we guide the team, we nurture the transformation of early learners into physicians, and our satisfaction is derived from their success. So these are stages that Holly Humphrey tells us that people go through as they're going along in their career, and these are really, by recognizing these, we can bring our learners to the next step more easily if we sort of recognize some of those characteristics. So what's our role? Well, a mentor is not an evaluator, and a mentor really is not an advisor even. A mentor is a supporter. It's somebody that tells the learner how they can achieve their goals, how they can move to the next step without being the person who actually grades them or provides them with feedback on a concrete individual skill. It's really helping them to achieve their own goals. A mentor can be a therapist. Sometimes it's a sounding board, and they can complain and they can sort of talk about things that have affected them just as a way, as somebody to talk to. A mentor can be a nudge, moving them along. I remember early in my career when I went to see my chairman, completely overwhelmed. I sort of walked in and said, you know, I'm really overwhelmed. I'm in over my head. I can't get any of these things done or done well. And I walked out with 2 more things to do. So mentors, you know, have to have that sort of innate ability to really push you along as a form of motivation. And then finally, mentors help the mentee get back to work. Very often a mentee will become stuck, as I had, and really they need to be sort of kicked in order to get them back on track. And mentors really can help to accomplish that. I think that as mentors, we need to be careful. There are lots of factors which are burning out our learners. As we said, we live in an age where the amount of knowledge they need and the amount of skills they need is multiplying exponentially, and it can lead to quite a bit of stress. So all these factors really are factors which lead to burnout. The fact that medicine really is a calling, that you work at it even beyond your endurance. You have to be compulsive to be successful in medicine, that there's an insufficient support system and a certain amount of immaturity in our personal lives. These are young learners who really are not yet equipped to really take on such a major professional engagement. Medical errors can cause burnout, they can cause depression. Sometimes that impression leads to quite a bit of impairment and people even leaving the field. And our environment doesn't necessarily support our early learners, the ones that are the most impressionable. There's overwork, there's a tremendous lack of control. Learners that make errors or are feeling overworked can often feel isolated. I must be the only one that's not being successful. So they sort of lose that sense of teamwork. They're not getting the help that they need. They're not quite sure what they're responsible for. Insufficient support from faculty. A lack of reflection time is a major problem in most learning environments. We really have, because of duty hours, we've compressed the time that learners can really spend thinking about what they do, and that's the first thing to go. Reflection time is really the first thing to go. And a lack of appreciation. It's very important, particularly for this generation of learners, to feel appreciated and to feel part of the team and to feel like they are making a contribution, and that lack of appreciation can sometimes lead to even worse burnout. So we have to be careful. We have to balance the amount of support we give to these learners to the amount of support that they are willing to accept and the amount of challenge they are willing to accept. So Humphrey tells us about this mentoring matrix of support versus challenge. And when the challenge is very high, but the support is not very high, learners will then begin to retreat. this can be debilitating, right? Their challenges are high, but they don't have the support they need to achieve that challenge, and they say, well, they just give up. So that's an important thing to avoid. If the support remains low and the challenges are lowered, well, that's stasis. Then nobody gets to grow. Nobody gets to do better work. It's just basically being in a holding pattern. When the support is very high, but the challenges remain low, that really just confirms the skills that they're already good at. So the goal of the mentor really is to have a high degree of challenge and a high degree of support, and only then do you get growth. So this matrix, keep this in mind, because you have to match the amount of support you're able, not just able, but willing and able to give to your mentees along with the challenge you expect them to achieve in order to sort of have a comfortable mix. So it's exercise time. I'd like you all to consider someone you know or used to know who was a good role model. What made them a great role model? What attributes have you already adopted from that person? What attributes are you still hoping to adopt? And then finally, what personal traits are you working to avoid? Because we all know that even our greatest mentors still have some challenging behaviors. So let's take 2 minutes, turn to the person next to you, and discuss these questions, and then we'll talk a little bit amongst ourselves. 2 minutes. Okay. All right, let's... Sounds like you had a lot to say. I feel badly that somebody came in just at that moment and must have thought that maybe we had finished already. It sounds like you all had a lot to say. Consider somebody who was your role model and what made them great? Who can maybe share with us a quick anecdote, a quick story? Don't be shy. If they were a great role model, we'd all like to know about it. Sure.
I had a very old anesthesiologist who was in upstate New York, Dr. Peter Kane. He was a very angry old man. And he knew every single thing of the world, but he would never teach anybody. And I managed to work with him, and he would not teach us anything. He was just a very angry man. But he, at the end of the 3 years, I was the only one he wrote letter for me in his whole life. And I learned every single thing from him, what he knew. And that was the only thing. I think I persistently talked to him and managed to understand him. And he taught me that. He never taught to anyone.
So this is, believe it or not, this is not an unusual story. You know, the mentor that literally makes it harder to learn from them, but the challenge, you know, becomes very worthwhile. And we're going to talk about letter writing in a couple of moments. Yeah.
One of my mentors during my fellowship at St. Chris, she not only worked me very, very hard and probably knew what I could do before I did, but I also really appreciated the way she practiced medicine and her engagement with every patient. You know, she looked at the films herself with the radiologist. She went down to pathology and looked at the slides with the pathologist. She went to the micro lab and, you know, she did it with her own eyes. And the lessons I learned from that, I, you know, still appreciate. Maybe not all the kicks in the pants, but I guess I appreciate that too.
Well, so that kind of role modeling and doing it yourself, and so that you can be sure. I mean, that certainly was a major part of most of our training. Is you always have that one mentor that really teaches you to be self-reliant, to never take other people's word for it, to think for yourself, and that can be incredibly stimulating, but also teaches a very valuable lesson. Maybe another couple of stories before we, yep.
Well, my mentor or mentress, as I call her, was a person who started out with a couple of really serious challenges in life. First of all, she was born at a time in India where it was not popular to be a female, and so all of her life she went through that struggle, and she basically became the highest ranking faculty member at a nearby university. She has an MD, a PhD, and also an MBA from Norton, and is the type of person that an older person like me really needs as a mentor. And the thing that she really taught me was to be fearless, how to be fearless. And the one wonderful thing is the fact that because she's still alive and has defied all these odds, that I can actually still counsel with her. And the advice that she gives me is really quite wonderful. And there's never a secondary agenda because she has achieved everything that she needs to achieve and helps people who are much younger than I am.
So talk about preventing burnout. This is someone who's literally fueled by the challenge. These are wonderful attributes, and they teach us valuable lessons. Maybe one more before we move on? I could tell you some of mine. I mean, I never had a single mentor. I never had someone that I could depend on, but my supervisors really over time have each sort of, you know, taught me small things. I had a wonderful lab supervisor during my fellowship whose dedication to me as a learner, to my life, more than even my skills, always impressed me. I remember early in my fellowship, it was just before the birth of my first daughter, and I got a phone call at 9 a.m. on a Saturday morning. You know, it was during my lab time, so it was not time that I was supposed to be working. And he calls me at 9 o'clock in the morning on a Saturday morning, and I was a little confused. Was everything okay? What's up? He says, I could not sleep all night. I said, why? He says, because over lunch yesterday you mentioned that you don't have life insurance and you're about to have a child and you have to have life insurance. I'm begging you. And I remember thinking to myself, who is this? Well, you know, so where does he come off thinking that he can, oh, actually, I probably should get life insurance. And, you know, I thought that was just a remarkable thing, that his concern about my life, my personal well-being was that severe. Another mentor of mine who I literally could not come in early enough to get a note on the chart before she did. And she was my supervisor, and I would come in at 7, and there would be her note. And I would come in at 6, and there would be her note. And I would come in at 5, and there would be her note. And I finally said, why? What are you doing at 5 a.m. to put notes on the chart? And she just was very casual about it. Oh, I happen to be seeing my private patients, so I saw the service patients as well. And I had to confront her and say, you have to give me a chance. I'm not there at 5 in the morning, and I don't think that we should be waking patients up at 4 in the morning to then write a note about. So that was a nice discussion, and I think it was important for me to sort of have that discussion with my supervisor and not just go along with the game. So lots of people can be mentors, lots of people can influence the way that you develop in your skills, but you need to sort of think about it and reflect on it and say, you know, what are the attributes that you hope to adopt, and what are the personal traits that you need to avoid to be successful to yourself. Whoops, okay. So, do's and don'ts of mentoring. Do be a role model. Make sure that you behave the way that you think your trainees need to. Write letters. Mentors need to write letters, they need to make phone calls, they need to support their trainees in order for them to move on. This is still very much an economy where letters and personal phone calls and personal relationships are extremely important to success. As a mentor, we need to budget time for our mentees. Mentoring a trainee is not something you do in the hallway. It's not something you do in passing. It's making time and budgeting time for them. Very important. It cannot be sort of rushed or brushed off, or we'll do it some other time. Allow independence. Your mentees need to feel that they are able to grow and that they're able to follow their own course even as you're sort of gently pushing them in one direction or another. Offer opportunities. When you have something going on, that's a great time to offer it to a mentee. Here are some don'ts for mentoring. Don't despair about the work environment. That's just going to add to burnout. These are young, impressionable mentees. They haven't built up their defense system yet. And when we despair about our own work environment, oh, the electronic health record is so difficult. Oh, you know, we don't have time, and, you know, we have to have these performance indicators, and, oh, all these things are so terrible. That's not a good idea to sort of spread that to mentees. Don't display arrogance or greed. This is a very important attribute. Just as we want to be good role models, it's important not to role model negative behavior. Don't fail to disclose conflicts of interest. You know, this goes back to offering opportunities. It's important that we offer opportunities for our mentees to grow, but this is not, you know, your opportunity to sort of grab some cheap labor. So it's important not to have sort of a conflict of interest that's going to corner the mentee into something. And don't forget that mentees are always watching. This is all that concept of the hidden curriculum, that they model what we do and not necessarily what we say. They're always watching, so if we role model negative behavior, they're going to pick up on that. So these are important do's and don'ts to keep in mind. When you meet with your mentees, when you've made the time, there are some questions you should ask. Is this the right discipline for you? Is this the right institution for you? Sometimes it is, sometimes it's not. And you have to have the honesty to say which. What's next? Always push your mentees. Always get them back on track. Always get them able to move to the next plateau. Our health system is very interested in developing people from within, and there's a physician leadership track within our institution that a lot of us are involved with. So I recently got a coach. They sent me a coach, and here I am in my 50s, and you know, what do I need a coach for? I'm already, you know, somewhere. I think I'm doing all right. And this guy is not a physician, and he's just an executive coach. And he sat down with me and says, well, what do you want to do better? What are some of the things that you'd like to do less of? And I described what I want to do less of, you know, and what I want to do more of. And he said, well, good, well, let's work on something that's going to get you there. And for the first time, I've got somebody who's, you know, in my corner and able to really focus on my needs for development, you know, here in my sixth decade. So always be ready to move your learners on to what's next. What steps are you taking to achieve balance? The notion of taking care of your learners and making sure that they're not going to burn out, that they have a good personal life, family life, that they're maintaining some balance in and out of the workplace is incredibly important. It's probably the most important thing you can do for your learners over time because it's going to keep them in the profession. How do you choose your career track? What things do you want to sample? Encouraging learners to even look outside of your own institution. I recently sent 2 of my learners on electives outside of our institution, even though that costs us money, it costs us GME money, but it was the right thing to do for them because their careers are going to be different than what they could achieve on the Upper East Side. What are you doing to maximize your chances to get what you want, and what additional resources do you need? So first you have to ask what it is they want to accomplish, and then what they're doing to maximize the chances of getting what they want. So when I meet with my coach, the first thing he asks me is, well, what have you done since our last meeting to move you closer to your goal? And I have to come up with something. Otherwise I get that look. Where I haven't really achieved anything, or I haven't, I hearken back to my piano lesson days where I forgot to practice in between. So it's important to keep your learner on their toes, that they're always doing something to maximize the chances of getting what they want. And then if they need additional resources, then planning out how those resources can be acquired. So these are important questions for your mentee. And then, of course, maintaining the relationship over time, check-in, and progress reports. Don't abuse your power, advice on goals and career plans, provide opportunities to develop communication skills, and get exposure. So these are all things that are going to foster your relationship, particularly checking in and getting progress reports. When not too long ago, I guess it was maybe 2010 or so, I was considering, what it takes to be a mentor. And I actually joined a mentoring group where they assign you like a high school kid. And I thought, well, this will be good. I'll learn about mentoring by being a mentor. And they filled out the questionnaire, please pair me with a kid who's interested in theater and science and museums and medicine and, all the things that I'm interested in. And they gave me a kid who is completely devoted to the New Orleans Saints. And I have to tell you, I'm just not a sports fan. I never have been. And we had nothing to talk about. And this was a 9th grader in a charter school in the South Bronx. And we had nothing. We had nothing to talk about for a year. And we would meet, we'd meet every couple of months, and we'd email a lot, and I would sort of tell him about my family and what was going on, and, he would tell me about football, and I was just not connecting. And my wife is a psychologist, and she's a school psychologist, and she said to me, you're going to have to learn about the New Orleans Saints. You're just going to have to do it. And she was right, so I studied. So I read a few things. I Googled whoever they were, and I opened up our first conversation of his sophomore year with, boy, I hope Breeze is able to throw some touchdowns. And the kid lit up like a light bulb. And I thought, holy cow, this is amazing. This is amazing. And we were finally able to connect on something. Now, of course, he was not going in the direction that, that I was able to offer. I brought him into the hospital. I brought him to autopsy conference one day, and he turned all colors of green, and he just ran out of the room as fast as he could. So this was not a kid that was going to be influenced by my views or by my skill set, but just having somebody, an adult figure that could identify with him or who took the trouble to identifying with him was, I think, very important. And he finished high school and he went on to college. I was pleased not to be in that group anymore because it was very stressful to me. But I learned a lot about mentoring. And one of the things I learned was that forced mentoring just doesn't work, right? So this was a program where every kid in that charter school had to have a mentor, and that first year was really, really difficult for us. But I also learned that it's important to sort of make sure that you're in tune with your mentees' desires and their interests, and to check in frequently and to check up on their progress. So this maintaining the relationship of checking in and progress reports really rang true to me when I read about it. And to be able to listen to your mentee and provide thoughtful advice and help them to network. So these are things that you can help your mentee sort of succeed even beyond their relationship with you. Now, you can have expectations of your mentee. You can expect your mentee to take responsibility for the mentoring relationship. So in a professional environment, it's really up to them to make their appointments with you, and to show up, and to show up on time, and to be engaged. Engage in self-assessment, in monitoring, in reflection, that they respect your time and your advice, and that they cultivate an appropriate personal relationship with you and demonstrate professionalism. These are all things that we can expect from our mentees, and it should be made clear that you expect them to come, when they make an appointment, and come on time, and if there's something that they needed to accomplish in between sessions, that they have done their homework, etc. They need to be respectful of your time and listen to the advice that you give. At the same time, there are pitfalls and landmines. Bias is a huge landmine. Preference and inhibiting your impartial judgment can really ruin a mentor-mentee relationship and needs to be avoided. Discrimination, unfair treatment based on their group. This can really poison a mentor relationship and really can poison somebody's ability to be successful in their profession. Harassment, unwelcome advances, and unfair treatment can ruin people's careers. And a hostile environment, the climate in which the above is tolerated, certainly can lead to an environment where burnout and leaving the profession is a high possibility. So it's important to teach mentees, therefore, to defend themselves. And this is a script that mentees can learn in order to defend themselves. And this is well known if you're into psychology. It's describing a behavior and how it makes you feel. So it sort of personalizes your experience of that behavior. Not to say you're a mean person, but when you do this, it makes me feel that, which is a better way of sort of putting something that is having a negative effect on your mentee. And that's because, and say why the behavior bothers you, so please, and then request the behavior to change. This is a very useful script, such as it is, to help your mentee to convey their feelings about what's making them feel less productive or less satisfied in their profession. When you do this, I feel that because of such and such, so please do something differently. And you have to give your mentees the courage and the ability to be able to say this to the folks that they're working with if it comes up. 5 Ds of secondary causes of poor performance. Very, very important things to keep track of and to be cognizant of. Depression, distraction, deprivation, drugs, and disordered personality. Depression, major, minor, adjustment reactions. It's okay to feel depressed, after your mentee, loses a patient. It's okay to feel sad and to feel defeated and what went wrong and to sort of reflect on that. But it's not okay for that to then become an obstacle for the rest of their day or the rest of the things they need to accomplish. Distraction, concerns about children, relationships, need to manage family or personal illness. Everybody's got a life both in and out of the workplace, and sometimes that life interferes. It's important for you to be close to your mentee so that they can discuss those kind of things with you. And you need to be able to encourage your mentee to take the time they need to deal with it, because they certainly can't do their best if they're distracted. Deprivation, very important, not to deprive yourself of sleep, of food, of social interaction. It's just going to add to stress and burnout. Drugs, obviously, alcohol, prescription drugs, illicit drugs. Statistics are that 2% of our trainees are engaged in some of this activity. 2%. So you've got a class of 100. Somebody in that class, my guess, is impaired in some way, and it's important to be on the lookout for it. Disordered personality, non-affective personality disorders really can impede people's ability to be successful. So here's something about depression. This is depressed by their lack of progress. Watson and Crick go to the bar for liquid inspiration, and here's the fella next to them. I'll have a double, Felix. Depression and substances, and yeah. Anyway, so I'm just going to end with Holly Humphrey's lessons learned. The secret of caring for your mentee is actually caring for your mentee. Confront the uncomfortable. Remember, we're here to help mentees stretch their limits. Correct misbehavior promptly and decisively. When you see somebody who is doing something wrong, it's important to call them on it. Don't take credit for other people's work. That's one of the first negative role modeling things that you can role model. And motivate followers and create a team. Remember, medicine is a team sport, and it's important that we live by that. Show respect and kindness for all. Remember, they're always watching you. Choose your words carefully and tend to the barometric pressure. So knowing when the mentee is under stress and knowing how to help them relieve that stress, very, very important. Know what to do when a colleague dies. This is almost an inevitability in a large department, and it can sometimes have a huge effect on our trainees. It's important that we acknowledge the passing of a colleague. Manage faculty, their comings and goings. Again, large departments, people come and they go. Some people, they will come to your program, come to your school because they were inspired by a particular individual, and the next thing they know, that individual has gone on to be somewhere else. That's going to be a disappointment, but it needs to be managed. And then finally, remember the primacy of family. Remember the slides that talked about balance. One of the most important things for your mentees is for them to maintain balance. That's how they stay in the profession. Otherwise, they burn out and they leave. So when my mentor called me up and told me to get life insurance, I took that very seriously. Just a couple of words about coaching. Coaching is how we take, mentoring sometimes is how we take struggling learners and sort of turn them into successful learners. Coaching is how we take good learners and turn them into great performances. And there's two people that talk about coaching. Jeff Weiss, who's the DIO at Tulane and the program director in internal medicine. He talks about motivation, and he makes sure that he knows his learners' names. He has a whole exercise that he does to learn his learners' names. He uses physicality in a very interesting way. You know, he doesn't mentor this way. He mentors this way, so that you're looking out in the same direction with your mentor, with your mentee. And it's a very simple, kind of almost silly thing, like a little ballet, but he feels it's very important that you both be sort of looking in the same direction. And the hook, which is his vision of the future. So he talks about envisioning the future and visualization. Where do you want to be? How do you see yourself? And how can you achieve that? So that's Jeff Weiss on coaching. And then the other person to look out for is Carrie Palomara, and I think she's at Harvard still. She is a wonderful, wonderful faculty member. I think she's still in her teens. I can't believe that she is a faculty member, but she's just incredibly young looking, but unbelievably energetic. And she talks about this. She says, set aside time for your trainees. Think about questions in advance. This is all part of being sort of respectful to the session that you have with your trainees. Create a comfortable and confidential environment. Reflection is key. She has her trainees talk about an I did list rather than a to-do list. So again, goes back to what have you accomplished between sessions, focus on their strengths, commit to change, and when things are going well, push even harder. So this is her formula for coaching. And she talks about what even the high-performing trainees, what are you least comfortable with and what would you like to improve? So I'm going to stop there. I appreciate your attention early in the morning, and I'll be happy to take questions.